Hello, Dr. Jeff Johnston here, coming to you from Denver, Colorado. Today I would like to talk to you about cracked teeth. Now, cracked teeth we're not talking about a huge split of tooth. We're talking about a very fine crack in the tooth. Cracked teeth are very hard to diagnose and treat. The reason they're hard to diagnose is a lot of times you can see them, but you don't know how far inside the tooth they go. Here is a chart, if you can see it, of different cracks in teeth. Some of these cracks stop at the crown and they're treatable, and some of the cracks go down the root space. Once they go down the root space, it is you have to take the tooth out. Nothing you can do to fix it. Now, what's causing these fractured teeth? A lot of clenching, grinding at night, a lot of abnormal forces on the teeth. A lot of the causes are metal fillings. Metal fillings micro-expand and micro-contract, and something's got to give. What gives? The tooth. The tooth gives, and it causes a fracture. Now, if you look at this picture here, here is a metal filling, and you see a crack going down. Now, this probably doesn't hurt the person. At the same time, the tooth's fractured. How deep is it fractured? I don't know. These things don't show up on x-rays. The fracture is right here, if you can see my screen, and does it stop right there at the gum line, or does it go down the side of the tooth? It's hard to tell. Like I said, these fractures don't show up in x-rays. The only thing you could do to treat this tooth is to put a crown on it. Once you prep it down for the crown and prep the crack, you can see how far down the crack inside the tooth goes, and you can see if it stopped right here or if it keeps going. If it keeps going, you kind of have to be a little worried about that it's down on the root surface and not treatable. This is all from something that's not bothering you at all. If this crack continues, and say a major crack forms here, you're liable to crack off this whole piece of the tooth. And when this piece cracks off, is it going to crack above the gum line or below the gum line? Is it going to crack on the root surface below the gum line? If so, that may be non-fixable. So with these cracks, they've been kind of raising their ugly head in my practice lately, and I've lost a few teeth to them. I'm a little bit more aggressive about treating them with crowns, just because I know the consequences. If you don't treat this with a crown, if this goes on for a long time, that crack's just going to get microscopically bigger, and ultimately you may have to take this tooth out if it cracks all the way down the root. So these fractures are very hard to diagnose, and sometimes they can be hard to treat. I see a lot of cracked teeth every day of my practice, and it's really hard to explain to the patient, hey, you have a cracked tooth. Well, it's not giving me any pain, and it's a micro-fracture. I don't know how far down the root it goes or where it goes. I know if we put a crown on it today or in the near future, I can prevent that from growing for you. Mainly getting the metal filling out of there and figuring out what else is causing the fracture. So this cracked teeth, and they're very challenging to diagnose and treat and understand, really. You think of cracked tooth, you think of the whole tooth split in half. And yes, that's what can happen over time. So that's my take on cracked teeth. Thank you.